Hi, everyone. My name is Chris Trudeau, and I'm a law professor at the University of Arkansas Little Rock William Bowen School of Law. And when I'm not teaching students, one of the things that I really focus on a lot is health literacy, health communication. How can we better comply with regulations while also connecting better with patients and research participants? And so I'm here today to provide a quick video for Patient Engagement Month to kind of complement some of the other videos that you've been receiving all month. So there's another plain language health literacy video that was created by Sue Stableford that you should certainly watch if you haven't already. That has a lot of the basics and the underlying kind of rationale behind things, and I'll talk a little bit about that, but mostly I'll focus on the things that you haven't heard elsewhere. So let me start the PowerPoint presentation, and we'll get started. So again, the focus that I'm here to kind of talk to you a little bit about today is this trend towards health literacy and health law and policy that can help you kind of get motivation or get some support for the change efforts that you're making throughout your organization. Before I get started, I have no financial interest to disclose. This is where I work. Otherwise, I'm just speaking kind of for myself and no other financial interests involved. So when you think about laws and regulations for health research and practice, which of these best fits your view? That they're just another obstacle to comply with that inhibits innovation, or they provide an opportunity to better connect with patients and participants? Well, of course, I wouldn't be here if I think it's just another obstacle to comply with that inhibits innovation. In fact, I think both of these, we can actually promote innovation while better connecting with patients and participants. And that's kind of my motto, is how can we do all of these things? Increase our compliance with laws and regulations and other policies while also better connecting with patients. And that's kind of the theme of my talk here. So a little bit about why this matters for healthcare organizations. Again, you might have heard this elsewhere, but I'll kind of give my own little spin on things in a minute. So if you think about coronavirus, which, obviously we can't think about hardly anything else in the past 2 years. How did the information delivery work in your organization? For both the public, that you're serving, but also employees. Clear communication is critical to that. How about for patients at your hospitals, right? How do people figure out what to do when you've changed the rules all of a sudden because of the pandemic? What about coronavirus's impact on your research activities? I work also at the University of Arkansas for Medical Sciences and help out with their research activities there. And ours were just thrown off until we figured out new policies and practices and kind of weighed, whether we can have folks come in person or whether we do some of these research activities online. There's just a lot that's involved, in communicating with folks is the key. And think about right now, vaccine rollout and booster shots and all of these things. All of this has been, focuses on how we communicate both as individuals and as organizations and as public health government agencies and, CDC and all of these things. Communication has been center stage. So I think the coronavirus I've been touting this universal precautions for health communication for years, and it's not new. I didn't make it up. Folks have been kind of saying this because you can't really tell who might struggle with information just by looking. But also, we've now had the case study of all case studies with COVID-19. Every single person has had to learn about COVID and kind of how to deal with it since the beginning of 2020. Even the scientists just discovered it in December of 2019. So everybody has had to learn about this. So when you're learning something new, which we've all done now with this, what's the best way to teach people things? Because, that's really what we're trying to do when people come into the health system. because even if people have familiarity with the health system, when they go to a new place or they see a new, provider, let's say somebody's had a lot of health problems and then they have their first baby. Well, what's the difference? How do things work in OB-GYN versus, the other types of places that they've been. So everybody's always learning. We're not born knowing everything. And so this is why I often think of this each one, reach one, each one, teach one philosophy. You hear about that. And that's really where it's all of our duty, right? Because we're learning new things all the time. If I were to, go in accounting firm, I wouldn't know anything about accounting. I had a class once or twice, but, I'd be learning all new things. It doesn't mean that my literacy level is low, but I just don't know about this particular thing. And so this is where, if we think about our role and, and what we know that other people don't, how can we help them along the path? So no matter what part of the organization, the healthcare organization you're in, you have a role in this clear communication. You may think, oh no, I don't ever see people, or I don't see patients, or I don't deal with research participants. Well, you might be the one actually creating the communications. You might be approving the communications if you're, on the legal, team, or part of risk or the risk team as well. You might not actually interact with folks, but you're the one that kind of has this overall approval of things, or you create the policies. So everybody is involved with this. So a little bit of things that I like to think about when we think about clear communication from a legal perspective in the health field, we think about forms, right? We think about all the forms people need to sign, whether it's consent forms or advanced directives or whatever it might be. What we know, and this is not a new study, this was from 1995 in JAMA, but we know that people struggle. In this study, 86% of the people didn't understand the rights and responsibilities section of a Medicaid application. And 60% of people didn't understand a standard informed consent form. So this has been kind of the study back in the 90s that started this field or kickstarted this field of health literacy into higher gear. From a consent document level, we know that most consent forms are written at a high level, 10th grade or above. And if you think about the average reading level of US adults, it falls, below the 8th grade level, 7th, 8th grade, depending on the study. And so when you have these forms that are written at a higher level, that shows you there's that disconnect there. People are going to naturally miss out on some of that detail and that nuance because they don't have the reading ability. That doesn't mean they can't figure it out, but we know how it is. You get all these things in the mail, you get this information overload, you look at it, you're like, oh, it's not that important to me, and you might throw it or put it aside. So we kind of have to remove our own kind of presumption of the fact that people are actually going to read what we write in a very detailed way. And in fact, that's not how people do it. And we know that from other studies. So now I always have to say this word of caution. So you might hear a lot about readability scores and those type of things, 8th grade level, 10th grade level, 6th grade level. Those do not equate to understanding. I could write a sentence that falls in the 5th or 6th grade reading level that you couldn't understand. It would just be gobbledygook. It would, it'd be easy words that don't string together to make, to make a sentence. And so readability calculators can be gamed, but what I like to do is just kind of use them as a general guideline to make sure it's around the right level. So if it's coming in at the college level or the high school level, it's probably going to be too hard for most folks. But once you start getting around that 7th, 8th grade, 9th grade level, you're like, okay, it's probably good enough. But there's better ways of doing that again, I'm not going to talk about here in this particular talk, just to keep it somewhat short, but there's plenty of other ways of testing material besides just running it through a readability calculator. So again, I use them, but I just use them as a general guide to make sure I'm going in the right direction. Because there's a lot of components of literacy, right? And understanding. If we even call it understanding, you've got prose literacy, which is what the calculators tend to SCORE, which is, the book style, paragraph style writing, but you also have document literacy. If you've been working in the healthcare organization for a while, people fill out documents wrong all the time. You've probably done it yourself. I know I have, because you're busy, you're thinking about other things. This is something that you've never done before, and you just kind of go along. But you also have quantitative literacy. How do people, or it's often called numeracy. We know people struggle with math. And so if you make them do calculations, they're going to struggle. But there's also, how do you communicate with people as well, verbally, and also the information you provide on the internet. So there's a lot of components beyond just readability of prose information. And so this is why I often say is, I'm a plain language guru. I'm one of the experts who does a lot of studies on plain language, but I realize that's the smaller part of things. Health literate communication is much broader than that. It's not only the words, but it's all of the other things that hit those other modes of literacy. And so when I think about this, I tend to remember that. How do we get this information out there? Now, I say that, of course, because, again, I'm going to start moving into the justifications for integrating health literacy throughout the organization. And so I say that to really just help you think, this is not just what we write. Of course, that's a huge component of it, whether it's on the web or in commercials or on forums, but it's also, how do you create this culture of clarity throughout your organization? Now, there's a lot of justifications for doing this, from legal justifications to more of your business and kind of public health justifications for things. So this is a study that doesn't get enough attention. It came out, I believe, in 2015 from Accenture. It's called Happy Patients, Healthy Margins. And some of the key things from this are, they say is a superior customer experience doesn't just strengthen patient engagement. It also correlates to 50% higher hospital margins. So if you need to get the folks who approve things, their attention, this is one of the good study to kind of send them, because there is some correlation to higher profits, when patient engagement is improved. Also, think about this, from the same study. A hospital system earning $2 billion in revenue would have to cut 460 jobs, assuming a loaded salary of 100K. Now, the accountants and the business folks can worry about loaded salaries, but you get the idea. 100K to achieve the same 2.3% margin benefit that improving the consumer experience might bring through revenue growth. That's pretty. Those are pretty telling statistics. So I really like that study for that. Also, the SCAN Foundation on patient-centered care, again, from about 2016. This came out about 6 months or so after the Accenture study. It says this: for the person receiving care, patient-centered care results in a greater sense of empowerment, a focus on wellness and quality of life, and a better care experience. There's also evidence that it improves the job satisfaction of healthcare providers who enjoy connecting meaningfully with patients and working as a team. So if you think about the quadruple aim, which is now the big thing, it's the triple aim, but adding in workplace satisfaction on things. That's what patient-centered care can do. And here's another one when you think more about the bottom line. For older adults, Medicare pays the hospital a certain amount for a hospitalization based on the person's diagnosis, regardless of length of stay. When the patient-centered care shortens the stay, the hospital receives the same compensation, but has lower costs, and it realizes a return on investment in patient-centered care. Okay, I'm back. I just had some allergies here. It's March as I record this, and I didn't want to cough on camera. So anyhow, back to the SCAN Foundation. There's some other things when we think about public health. This was one of Arkansas Department of Public Health's goals, was childhood obesity, and this was again from a few years ago when I first moved to Arkansas. But by 2019, increased the proportion of infants who are exclusively breastfed at 3 months from 29.1% to 35%. And if you think about these type of goals, these broader kind of organizational, governmental, public benefit type goals, these large goals, you often can figure out that a lot of reaching that goal involves around teaching and understanding. So lack of knowledge and education is one of the biggest barriers to breastfeeding. So are social pressures and norms, but again, the more that you educate folks, the lower those social pressures and norms become, because the more people who know this, you know, the less it is a stigma, or it really isn't a stigma. But again, people who don't know any better. So lack of knowledge and education and kind of this communication is critical to these things. All right, so what about the regulations? You know, this is all well and good, kind of the policies and those, and kind of the general ideas. But what about the regulatory trend towards clear communication? Well, the thing is, you see this everywhere. You see policies, you see international laws, you see US laws that relate to these things or have some component that relates to clear communication. So you might not understand all these acronyms, you know, and that's perfectly fine. But just to show you that, this slide's just to show you that no matter where you look, you can find something that kind of supports an effort towards clear communication. So there's a national action plan to improve patient understanding that's been promoted by the World Health Organization since 2008. You know, they called for this. The United Nations has called for the development of appropriate action plans to promote health literacy. And the United States has created one. We passed the Plain Writing Act of 2010. Scotland is on version 2.0. Germany, Portugal, Australia, Austria, China even had the first policy mention of patient understanding and health literacy back in 2008. And then Canada, Netherlands, Singapore, Ireland, so many people are working towards this. So if you're thinking about a global movement, that's what we're doing here. So I often find that's helpful when you're trying to kind of motivate folks on a broader level about why this is the right thing to do. I mean, this is something world over that people are thinking about. There's many US government agencies that support health literacy. I mean, you can almost pull some policy statement from almost every agency there is. CMS Rural Health, for example. Rural health, it's critical, clear communication and health literacy. And so this is one quote from their CMS Rural Health Strategy. You know, collaborate with rural communication networks to develop and disseminate easy to understand materials to help rural patients navigate the healthcare system. So if you think about, you know, New Hampshire and kind of where you are there, there's a lot of, you know, folks that might be considered rural. I mean, maybe not as rural as some of the plain states and those type of things, but folks that, you know, that need this help. That's a big problem in Arkansas is rural healthcare and getting people to their right providers and providing the care that they need, you know, at the time that they need it. And so there's a lot of good information in this strategy guide. The CDC has an action plan to improve health literacy. So if you think about the CDC in the past couple of years, this action plan has been there much longer than that. And so the idea, again, there is to create a framework that supports clear communication and health literacy. So for all the problems people may have had, oh, CDC said this, and then they say something else in the last, you know, the last couple of years because of COVID, they do, you know, their communication is pretty good. We were all learning on the fly. So I don't fault them at all. So when you talk about CDC and their health literacy goals, there's plenty of information there to support whatever it is you want to do. So if you think about CMS, the Center for Medicare and Medicaid Services. So whether you call this a regulation or a contract or whatever, these often guide a lot of hospitals and health systems because, again, in order to get reimbursed by Medicare and Medicaid, you have to follow these conditions of participation. So, you know, I treat them as laws, even though they might technically not be considered laws. So there's a lot in these. If you ever seen these manuals, they can be pretty thick. But for example, for the long-term care manual, they say the resident in a long-term care facility has the right to receive notices orally, meaning spoken, and in writing in a format and a language that he or she understands. So again, if you're thinking about, you're working in that kind of long-term care capacity, you're like, well, I don't think our patients and their families would really understand the information we provide. There's actually support for that. And here's what the CMS guidance states about what does it mean to be in a language that people understand. It's defined as communication of information concerning rights and responsibilities that is clear and understandable to each resident, to the extent possible, considering impediments which may be created by the resident's health status. If the resident's knowledge of English or the predominant language of the family is inadequate for comprehension, a means to communicate the information concerning rights or responsibilities in a language familiar to the resident must be available. So if you are at all into the translation aspects in healthcare, you've got great support there. Now, there's also been cases. There's not a lot of cases that actually relate to health literacy. There have been a few, and typically they tend to focus on folks that speak other languages, where English is for whom English is their second language. But one of the big ones was the Wells settlement for Louisiana Medicaid denials. And so this resulted from a case where Louisiana Medicaid kind of denied, or the Louisiana Department of Health and Hospitals denied Medicaid for a person, really a lot of people. But one person, Monica Wells, sued, suggesting that, the reasons for the denial were not understandable, and she didn't understand how to appeal and all of those type of things. And so the settlement, which was a result of the litigation, requires the Louisiana Department of Health to describe specific reasons for denial in plain language and in sufficient detail to know the denial and the rationale. They actually had to create a whole website that kind of explains things. But that is, I have friends in other health systems and in health insurers who say this is kind of our cautionary tale. If we if we are engaged in denying Medicare, kind of saying, oh, this isn't covered by Medicare, we need to be, or Medicare or Medicaid, this is something we really need to think about. And so again, it's a cautionary tale of, how clarity can help you avoid these problems in the first place. Again, back to conditions of participation. If you think about home health conditions of participation requires a patient's rights notice that includes the patient's right to actively participate and develop and update their plan of care. And it needs to be written in a language and manner that patients can understand. So you can find something almost anywhere you go. This is one of my favorites because I'm a lawyer who writes a lot of informed consent forms. So I love it when we're kind of, see this bashing my own kind in many ways. Informed consent requires that a patient have a full understanding of that to which he or she is consented. An authorization from a patient who does not understand what he or she is consenting to is not informed consent. That's a great statement because I've often said that. It's like, even though they're signing the bottom of the form, if they don't know what they're signing, that's going to make it, we're not doing our jobs, basically. And that's, and we see that from the conditions of participation. Now that doesn't mean if you violate that, for example, that the hospital's going to get fined, because the Joint Commission and others don't actively enforce these, but it certainly gives you a lot of room to kind of advance your efforts. And here's another one I was thinking about, and this is from the Joint Commission from 2007, so it's not even recent. Informed consent forms that are written by lawyers for lawyers do not increase the knowledge of those who, with their signature, are committing to allow the performance of treatments and procedures that may be associated with significant risks. The typical informed consent form is unreadable for any level of reading. So I say amen to that, because we can do better. We can still talk about technical things, whether they be health related things or legally related things, and convey that in reasonably understandable language. Now, I say reasonably, that means 95% of the time I can make it very clear. And there's some other things where it's a little bit harder, but we can still do a much better job than what we're currently doing. There's a lot of accrediting standards and actual regulations that require clear communication. So this is from the Affordable Care Act. There's actually 4 direct mentions of health literacy in the Affordable Care Act. I'm not going to read all these to you, but you can see what they require. It requires training providers in cultural competency and health literacy. So again, organizations who kind of are pushing this, you can have some regulations to push what it is you're trying to do. And for those, again, who are in language translation or healthcare translation, Section 1557 requires health providers to provide language assistance for those with low English proficiency. Again, nearly all of whom have low health literacy. I added that part in, but we know, because again, we're talking about health literacy in the English language that they have to understand, and so that's going to be difficult unless we're providing those adequate language translation services. Now, I mentioned the Plain Writing Act of 2010 a number of years ago. Now, this doesn't apply to private organizations. It applies to federal government agencies, and it requires those agencies to use plain language in any document where there's a federal benefit or service, or gives information about a benefit, or explains how to comply with federal requirements. Now, the problem with this is it's a law without teeth. There's not really any punishment for not following it, but the agencies have taken it seriously for the most part, because there's report cards that are issued by the Center for Plain Language and those type of things that kind of use public opinion to kind of get folks to comply. There's state-based laws that promote clear health communication as well. So, for example, the Caregiver Advice Record Enable Act, which is called the CARE Act. I love how people come up with these acronyms. Has been pushed by the AARP for a number of years. And New Hampshire has one, Michigan has one, Arkansas has one. For example, here's Michigan's law. Training or instructions provided to a designated caregiver shall be provided in non-technical language and in a culturally competent manner. So again, you've got to think about how you're clearly explaining things. Our Arkansas Act says this: the hospital will educate the caregiver concerning the aftercare of the patient in a manner that is consistent with current accepted practices and is based on the learning needs of the caregiver. So again, these are related to what the person could actually understand. Now, this regulatory trend is also happening internationally. GDPR, which is the General Data Protection Regulation, which if you've been on any major website that also targets the European Union, you've probably clicked on something that says you agree to certain things, and you may not have read it, but that's why we have it, because of the General Data Protection Regulation. But from a plain language standpoint, it's great. They've got some great language in there for talking about plain language and clear, understandable information. So you can see this. When seeking consent, orgs should ensure that they use clear and plain language in all cases. This means a message should be easily understandable for the average person and not only for lawyers. Organizations cannot use long, illegible privacy policies or statements full of legal jargon. And then what I really like about the GDPR is they actually say, okay, we know a lot of folks, children will be using the internet and kind of and be getting these policies that they have to click on. And then they say that, well, given that children merit specific protection, any information and communication we're processing is addressed to a child should be in such clear and plain language that the child can easily understand. So again, for the hospital setting, we can think about these and say, okay, well, we know we're going to be serving a broad audience, from the elderly to, children to, newborns and all of these things. And so how we communicate needs to run, run the gamut there. Now, from a research perspective, there's been a lot of movement towards clear, understandable information. And so I'm not really talking about that here today. I just wanted to kind of, drop a couple of ideas about this, since the organization has a lot of research activities. But the European Union has a lay summary requirement that has led to a lot of progress for clear communication in clinical trials. It's actually, there's summits now about how to write, result summaries in clear, understandable information. There's been a change in the US common rule that requires information to be presented in language understandable to the research participant. There's been a lot of movement in that regard. So no matter what part of your organization you're at, that's the bottom line, is that there's a regulatory trend that will help you do what you're trying to do. You know, a lot of those policies don't always use the term health literacy, so they focus on understanding, but that's really the bottom line. We want people to understand and be able to act and make decisions that are in the best interest, you know, for them. But if we don't explain things in ways that people can understand, then that's not going to help us. So bottom line of this presentation is that no matter your role within the organization, you know, you have a part to play in advancing clear, understandable communication, even if you're not the ones creating it, but you might be the ones delivering the message, or you might be the ones approving the message. And so you can find some law or policy statement to help you do what you want, to help advance clear, understandable communication in your organization. So happy Patient Engagement Month, and thank you all for listening to this, and I appreciate it. Bye-bye.